Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we're going to be talking all things heart disease. February is Heart Disease Awareness Month, and you may be wondering what exactly heart disease is and why we have an awareness month dedicated to it. According to Comfort Caregivers Incorporated, heart disease is a leading cause of death among men and women in the United States. Every year, 1 in 4 deaths are caused by heart disease, and this number increases for women especially, claiming the lives of 1 in 3 women. Heart disease is deadly, but what is it? According to Unicity Healthcare, the phrases heart disease and cardiovascular disease are used interchangeably to describe the various conditions that affect your heart. Heart or cardiovascular diseases include blood vessel diseases, heart rhythm problems, and congenital heart defects. The most common form of heart disease in the United States is coronary artery disease, or abbreviated as CAD, which occurs when the arteries that supply blood to the heart become hardened and narrowed due to a buildup of cholesterol known as plaque. Coronary artery disease can lead to health issues such as heart attack, heart failure, angina and chest pain, stroke, and irregular heartbeat. Unicity Healthcare also says that heart disease can strike anyone, but certain individuals may be more at risk than others. Some of the most common risk factors for heart disease include high blood pressure, high cholesterol, diabetes, obesity, poor diet, an inactive lifestyle, cigarette smoking, and excessive alcohol consumption. You may know the risk of heart disease, but what does heart disease actually look like? Heart disease is not one specific set of symptoms or causes, and people with heart conditions often have vastly different experiences. So we've gathered a few personal stories to show a few of the different ways heart disease can affect anyone. Our first story comes from Seconds Count. A family history of heart disease was all the reason 65-year-old Gary Lawrence of Gainesville, Georgia, needed to stay proactive about his heart health. But despite regular visits to his cardiologist and cholesterol-lowering medication, Gary started to notice a decline in his energy levels. He wasn't able to exercise as strenuously, and he had lost a lot of the stamina he had built up from years of exercising. He was consistently tired and lethargic. Doing house and yard work was very difficult, and he just didn't have the energy for it. Right around that same time, he and his wife were going through a big move from Texas to Georgia, and looking back, he can't believe he was able to lift those heavy boxes feeling the way he did. Shortly after his move, Gary resumed his regular cardiology appointments, and a series of tests revealed 2 blocked arteries. The blockages within his arteries were prohibiting blood from flowing freely to the rest of his body, explaining his low energy levels. Gary and his doctor discussed various treatment options and together decided angioplasty would be the most effective treatment for restoring Gary's quality of life. He and his wife were scheduled to go to Europe in less than 2 weeks for their 40th wedding anniversary, and missing that wasn't an option. A fast recovery and a fast return to his normal life played a large part in his decision to undergo angioplasty. During Gary's angioplasty, a catheter, which is a long, thin, flexible tube, was inserted into the femoral artery in his upper leg and carefully guided through the artery up to his heart, where 2 small stents were placed to open the blockages and restore blood flow. Shortly after the procedure, Gary was up and moving around. The next day, he was able to leave the hospital and return home. Even more impressive is that less than 2 weeks following the procedure, he was touring Europe with his wife. They were both, though, a little hesitant at first, but it didn't take long before they were walking the streets, climbing hills, and touring King Richard's castle. Gary didn't tire at all and had more energy than he had had in years. It's been more than 2 years since Gary underwent angioplasty. He has found new confidence in his ability to push his body physically and is enjoying taking part in activities he might not have been able to do before his angioplasty and stent. He didn't realize how much this condition was impacting his quality of life. Now he can go whitewater rafting, volunteer in his community, and jet ski without worrying if his body can keep up. And in fact, he just finished a 420-mile jet ski trip with energy to spare. Gary makes sure to keep up with his physical fitness, which is one of the most effective ways to keep heart disease at bay. Leading a healthy lifestyle can help reduce your risk of heart disease, as well as help reduce your symptoms if you already have received a diagnosis. Gary was able to undergo a minorly invasive procedure that greatly improved his quality of life, and most likely the number of years he has left. Many people are able to control their heart disease through minor procedures and medication, but sometimes risky surgeries are necessary. The best way to prevent the need for risky surgeries and even medication is to go to your doctor for regular checkups. Another story from Seconds Count highlights the importance of regular doctor's visits. All of a sudden, Jack Blatherwick couldn't take 50 steps into his 4-mile daily walk without extreme chest pain. With a PhD in physiology and a career overseeing the conditioning of professional and Olympic ice hockey players, Jack, who is 65 years old, recognized his symptoms as angina, the chest pain that occurs when arteries to the heart are blocked and the heart is starved for oxygen. But he had trouble grasping how suddenly the angina had come on. Just 3 months before, he had played super hard on the ice with members of the Washington Capitals professional hockey team, and he had felt no symptoms. And on top of that, he had always been active. As the physiologist for 5 professional hockey teams and for U.S. Olympic hockey teams from 1980 through 1994, and as well as being a jogger for 40 years, running 6 to 7 miles 5 times a week, a fall from a ladder 3 years earlier had ended his running, but he had taken up walking 4 to 5 miles a day, often near his permanent home in St. Paul, Minnesota. Jack always ate pretty healthy, and he had low cholesterol, high HDL, the good cholesterol, and his blood pressure was low. About the only thing he didn't do was go to the doctor regularly to get checked. However, there was one risk factor for heart disease that Jack couldn't control: his genetic heritage. Both his father and uncle had died from a heart attack in their 50s. When he arrived at Abbott Northwestern Hospital in Minneapolis with angina, doctors performed an angiogram, a diagnostic test that enables them to see blockages in the arteries. The results showed multiple vessels with blockages of 90% or more, some of which were located where blood vessels branch or bifurcate to deliver blood to different parts of the body. The cardiologist who reviewed Jack's angiogram told him he should prepare for coronary bypass surgery. They told Jack they were uncomfortable with the idea of opening blockages with angioplasty and inserting stents near bifurcating arteries. In angioplasty, an interventional cardiologist threads a catheter or small tube with a tiny uninflated balloon on its tip to the blockage. The physician then inflates the balloon to push the plaque or fatty deposits to the artery wall. A stent, a small metal mesh tube, is then typically inserted at the tip at which the blockage was cleared to prop open the artery. Jack's open heart surgery was scheduled for a week later, giving him time to take care of some team business in Washington and make preparations for the 3-month recovery he expected after bypass surgery. Jack even found time to build a small door to let his dog in and out of the house during his recovery. While he was in Washington, Jack received a phone call from Abbott Northwestern interventional cardiologist Dr. Timothy Henry. The news was good. After further review of his angiogram, the cardiology team had decided it would be okay to go with angioplasty and stents. Jack would not have to undergo the trauma of open heart surgery and a long recovery. A few days later, Jack underwent angioplasty and stenting. When the procedure was finished, Dr. Henry had inserted 6 stents, all at different locations in Jack's coronary arteries. According to Jack, at least one of them was implanted at a vessel bifurcation. Jack spent 1 night in total in the hospital, and he felt totally recovered as soon as he walked out of the hospital. He said he's just floored at how far medicine has advanced. Skill, experience, and knowledge are critically important for all physicians, of course, but angioplasty might require another factor. Dr. Henry saw solutions where there were unique problems. It is apparent that creativity will play an important role as this procedure advances. Jack's back at work, he takes walks in the morning and afternoon, and he's building an addition on his house, so he's allowed himself to temporarily stop lifting weights. If there's one bit of advice he'd offer about preventing coronary blockages, it's this: no matter how heart healthy your lifestyle, you need to see a cardiologist. He wished he had seen a cardiologist, had a blood test every 6 months, and had the protection that medications may have provided. If you have a family history of heart disease, make sure to regularly see your doctor. There are many ways your doctor can monitor potential issues and diagnose heart disease. According to Mayo Clinic, tour doctor will perform a physical exam and ask about your personal and family medical history. The tests you'll need to diagnose your heart disease depend on what condition your doctor thinks you may have. Besides a blood test and a chest x-ray, tests to diagnose heart disease can include an electrocardiogram, or also known as an EKG. An EKG is a quick and painless test that records the electrical signals in your heart. It can spot abnormal heart rhythms. You may have an EKG while you're at rest or while exercising, which is called a stress electrocardiogram. Your doctor may also use a Holter monitor, a portable EKG device you wear to continuously record your heart rhythm, usually for 24 to 72 hours. Holter monitoring is used to detect heart rhythm problems that aren't found during a regular EKG exam. You may receive an echocardiogram, a non-invasive exam that uses sound waves to produce detailed images of your heart structure. It shows how your heart's beating and pumping blood. Your doctor may choose to perform a stress test. This type of test involves raising your heart rate with exercise or medicine while performing heart tests and imaging to check how your heart responds. Another option is cardiac catheterization. In this test, a short tube or sheath is inserted into a vein or artery in your leg or groin area or arm. A hollow, flexible, and long tube guide catheter is then inserted into the sheath. Using x-ray images on a monitor as a guide, your doctor carefully threads the catheter through the artery until it reaches your heart. During cardiac catheterization, the pressures in your heart chambers can be measured and dye can be injected. The dye can be seen on an x-ray, which helps your doctor see the blood flow through your heart, blood vessels, and valves to check for problems. And you may also receive a cardiac computerized tomography, or a CT scan. In a cataract CT scan, you lie on a table inside a donut-shaped machine. An x-ray tube inside the machine rotates around your body and collects images of your heart and chest. And the last type of test your doctor might give you is a cardiac magnetic resonance imaging, or an MRI. A cardiac MRI uses a magnetic field and computer-generated radio waves to create detailed images of your heart. Heart disease affects 1 in 4 people. Your chances of experiencing some form of heart disease in your lifetime are fairly high. It's important to know the signs to look out for if you do have heart disease. Knowing the signs could save your life. And the last story we have for you from Seconds Count could have turned out much differently if Jack didn't know the signs. One of the last things on Jack Hatley's mind the day after he turned 37 years old was heart disease. While the Pittsburgh resident had a history of high blood pressure, it was under control with medication, and he had no other indications of heart trouble. So it caught him by surprise when he began to feel overheated and uncomfortable while working in his garden. He had dealt with high blood pressure and high cholesterol, but he was average weight and enjoyed outdoor activities. It was a complete shock that he could be at risk for a heart attack, especially at his age. Home by himself in July of 2013, Jack began feeling progressively worse. Perhaps because he is married to a nurse practitioner and has a brother-in-law who is an emergency room physician, he knew he should get help. That was when he felt he got hit in the chest with a baseball bat. Jack recalls the chest pain as being significant. At that point, he was certain what it was. He was having a heart attack. When he arrived at nearby Allegheny General Hospital, Jack was still experiencing chest pain and sweating. He was afraid. He didn't know what would happen. Quickly, he was taken up to the cath lab, the area of the hospital with specialized cardiac imaging equipment and tools to perform procedures such as an angioplasty. His physician, Dr. M. Chakravarti, placed 2 stents to open up the blockage in his LAD, the left anterior descending artery of his heart, which is responsible for supplying the heart with much of the blood it needs. Jack says the treatment saved his life. He stayed in the hospital for a few days before he was able to go home. For Jack, the return home from the hospital was just the beginning of his recovery. He was happy to be alive, but the stress and fear of another heart attack haunted him for some time. For the next 6 to 9 months, he had a hard time sleeping. It was a difficult experience, and he was afraid it would happen again. Jack needed to recover physically and also emotionally. He sought out counseling to help him manage the stress of his life-changing experience. It was a tough year for Jack. It made him reflect on how fleeting life is. Seeking help kept Jack on a course to recovery. He also joined a cardiac rehab program at his hospital. Cardiac rehab programs help heart disease patients recover more quickly and manage their risk factors through fitness training, nutrition counseling, and other services. He is in better shape now than he's ever been. He can run now, He runs 4Ks and swims. Jack says he can't stress this enough. Fully commit to your cardiac rehab program. Follow your doctor's advice on medication and diet. It will change your life. Finding a doctor he respected and trusted was also key to his recovery. Jack credits his interventional cardiologist, Dr. Robin Goddard of the University of Pittsburgh, in helping him fully understand the recovery process. A year later, Jack was able to celebrate his birthday and the 1-year anniversary of surviving his heart attack. Jack says that having a heart attack was a horrible feeling. It was scary, but now he's in a better place. It may take some time, but you can get the help and get over it. Take your recovery seriously and you'll see how you can improve your health. Jack was lucky he knew the signs. He was able to recognize what was happening in time to get to a hospital. After he got out of the hospital, he put in the work and followed through with his cardiac rehabilitation. If you have a heart attack or another sudden heart condition, once you are physically able, you should begin cardiac rehabilitation. According to the CDC, cardiac rehabilitation is an important program for anyone recovering from a heart attack, heart failure, or other heart problem that required surgery or medical care. Cardiac rehabilitation is a supervised program that includes physical activity, education about healthy living, including how to eat healthy, take medicine as prescribed, quitting smoking, and counseling to find ways to relieve stress and improve your mental health. A team of people may help you through cardiac rehabilitation, including your healthcare team, exercise and nutrition specialists, physical therapists, and counselors. Cardiac rehab is a lot of work, but it will give you so many benefits. Take a Heart says that structured exercise improves cardiovascular health, reduces risk factors and symptoms, and improves overall mood. Education and skill building enable patients to manage their conditions and make lifestyle changes that enhance heart health. Counseling helps patients reduce stress and address psychosocial factors that impact their health. While heart disease may be avoided by living a healthy lifestyle, genetics play a large part in some individuals' chances of developing heart disease, which is why it's important to get regular checkups with your doctor. It's much better to catch a problem early than to have to go through a traumatic surgery and recovery. If you do have to have surgery, it doesn't mean that your life will never return to normal. Many people end up being healthier than they ever have been after completing cardio rehabilitation. We want to say thank you for joining us here today at All Home Care Matters. All Home Care Matters is here for you and to help families as they navigate these long-term care issues. We invite you to please visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to, and please, if you know someone who could benefit from this episode, please share it with them. And remember, you can listen to the show on any of your favorite podcast streaming platforms and watch the show on our YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We look forward to seeing you next time here at All Home Care Matters. Thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.